Good evening and welcome to this live telephone town hall. Tonight we are dialing out to tens of thousands of homes in the 7th Congressional District of Pennsylvania. On this telephone town hall tonight, we will be answering your questions live, including questions about the coronavirus. Representative Susan Wild will be joining us in just a moment, and also joining us will be Dr. Peter Ender, an infectious disease specialist at St. Luke's University Health Network, and State Representative Peter Schweier. They will all be joining us in just a moment. But first, I want to tell you how you can participate in tonight's telephone town hall meeting. Please press 0 if you have a question. Press 0 and you'll be placed in a queue, and our operators will then assist you in asking questions. And then Representative Wild and the other speakers will answer as many questions as possible tonight, time permitting. So please press 0 at any time if you have a question. If you have a question but don't feel comfortable going live, you can let your operator know, and we can read the question for you, whatever's most comfortable for you. I also want to let you know that you can press 7 at any time to submit your email address to get the very latest from Congresswoman Wild. She and her team will add you to their email newsletter list, and you'll receive updates. It's a great way to stay informed about all of the issues. So please press 7 at any point throughout the call. I will repeat myself, as we've just had many friends and neighbors join the call, and we want to welcome all of you to this live telephone town hall, and we are dialing out to tens of thousands of homes in the 7th Congressional District of Pennsylvania. On this telephone town hall tonight, we will be answering your questions live, including questions about the coronavirus. Representative Susan Wild will be joining us in just a moment, and also joining us will be Dr. Peter Ender, an infectious disease specialist at St. Luke's University Health Network, and State Representative Peter Schweier. They will all be joining us in just a moment. I want to tell you how you can participate in tonight's town hall, though. Please press 0 if you have a question at any time. You'll be placed in a queue, and our operators will then assist you in asking questions. And then Representative Wild and the other speakers will answer as many questions as possible tonight in the time we have allocated. You can also press 7 at any time to submit your email address to get the very latest from Representative Wild's office. Congresswoman Wild, we have a good audience here for you tonight, and we'll turn it over to you.
Thank you so very much. Good evening, everyone. This is Representative Susan Wild. I really want to thank you for joining tonight's telephone town hall on coronavirus. This is a critical time for our country and the world, and the best we can do is arm ourselves with knowledge and look out for one another. This is not a time to be critical or political, but rather to find solutions. I also appreciate it if you will all bear with us if we have any technological problems. Hopefully we won't, but this is sort of a new thing for us. Tonight I am pleased to be joined by State Representative Peter Schweier and Dr. Peter Ender, an infectious disease expert and doctor at St. Luke's. They will help answer your questions in regard to the state and local response, as well as guidance from the medical community. We will do our absolute best to answer as many of your questions as possible, but please understand that this is a constantly evolving situation, and we may not have the answers for everything. As much as anything, I want to hear your concerns and questions so that we can take them back to Harrisburg in the case of Representative Schweier, and Washington, in my case, to assist us in formulating policy. As I said before, coronavirus concerns are in no way a political or partisan issue. Despite what you may have seen or heard on national television, we at the federal level and everyone at the state and local level, as well as in the many private sectors that this pandemic affects, are working to ensure the health and safety of our community. Before we get into your questions, I wanted to give you a short update on our efforts. First of all, in the wee hours of Saturday morning, Congress passed the Families First Coronavirus Response Act, which provides free COVID-19 testing, paid emergency leave for up to 2 weeks, enhanced unemployment insurance, food security, and health security. This is in addition to an $8.3 billion supplemental package that was passed a week before to provide federal assistance for medical research and development of a vaccine and to start to deal with the economic effects of the virus. Last week, on Friday, I invited a large group of local community leaders to form a working group to address this situation. On Friday morning, we held a call with more than 30 state, local, and industry leaders right here in our district to discuss our community's response to the coronavirus pandemic. On this call, we had representatives from the healthcare, emergency management, education, business, and elder care sectors, as well as elected leaders on the state and local level. I felt that call was both productive and necessary. It's very clear to me that the need for continued state, local, and federal collaboration on a holistic response to COVID-19 in Pennsylvania 7 is necessary. We will continue to post updates about this situation and local efforts on my House website at wild.house.gov/coronavirus. Please make sure you check it daily. On the phone call that I had with community leaders, we heard from the healthcare sector, specifically representatives of Lehigh Valley Health Network and St. Luke's University Health Network, as well as the local public health authorities. The most important takeaway from their portion of the call is that both hospital networks have established hotlines for coronavirus questions, including symptom and treatment guidance. I strongly encourage everyone to use these hotlines before you head into an emergency room or an urgent care center. The health networks have test kits that can and will be used when deemed medically relevant, and they are expecting more shipments of the test kits in the coming days. For both of these hotlines, nurses are going to be assessing symptoms in accordance with the most recent CDC guidelines. For Lehigh Valley Hospital, dial 1-888-402-5846, which is 1-888-402-LVHN. For St. Luke's, dial 1-866-785-8537 and press option 7. From the school district representatives that were on the call, the biggest takeaway I heard was the need for consistency and continued communication and uniformity in any guidelines regarding closures and reopenings. Of course, things have changed since Friday morning when we had the call. Governor Wolf has now shut down Pennsylvania schools for 2 weeks starting today, and the schools continue to distribute meals, although concerns remain about access to student support services. I'm going to be organizing a follow-up call with our local school leadership to further address these concerns, and we will make sure to continue to keep you updated about the ability to access school meals and provide all of the services to our students, including, I know, the pressing issues concerning graduation. From the business perspective, everyone on the call was concerned about the long-term effect of local and county-wide closures on businesses, particularly in the service sector, and the impact on independent contractors and the gig economy. I look forward to continuing to work with all of our local businesses and the Chamber of Commerce, particularly the Small Business Division, to find possible ways to work together and get them the resources they need to support their business and workers. And finally, from the senior perspective, I want to emphasize that if you have loved ones in a nursing home, please call in advance of visiting, as some of those nursing homes are implementing measures that include no visitation policies. And if you're a volunteer, please check ahead and make sure that you find out if your shift is still needed. Again, my top priority is that everyone in the Pennsylvania 7th District be as healthy and as safe as possible. We really do not want to perpetuate panic. We want to have a measured and evidence-based response. And with that, I am going to turn it over to State Representative Peter Schweier for his comments on the state response. Thank you, Pete.
Thank you, Congresswoman, and thank you for your leadership throughout this entire process. I was one of the folks that was on your Friday call last week, and it was one of the most comprehensive and robust conversations, including all levels of government, local, state, and federal, along with our healthcare community and the Chamber of Commerce and other folks. And it was a really well done call, and it was very robust. Folks on the call, thank you for joining us today. This is the third or fourth call I've had today. We were actually in session in Harrisburg earlier today. I am back in Allentown now. And there's been a lot of changes and a lot of work going on from the Commonwealth's perspective, from the state's perspective. Most notably, as Congresswoman Wild said, Governor Wolf has closed all non-essential businesses as of 12:01 midnight tonight. That includes everything from bars and restaurants and retail establishments and shopping malls and museums, et cetera, et cetera, et cetera. It does not apply, this is important, it does not apply to grocery stores, pharmacies, gas stations, things that we need to continue to live a relatively normal existence during the height of this crisis. So you will still be able to go to the local Giant or Redner's or Weiss Markets or Farmers Market or wherever it is you do your grocery shopping. You will still be able to go to your pharmacies to pick up any needed prescriptions, and you will still be able to purchase gasoline. This does include, and this is a very Pennsylvania-specific issue, this does include our state liquor stores. They close at the close of business tomorrow, the 17th. So you have one more day to go to the state stores, which folks have been asking us about. It is important to know that the Commonwealth has also taken some pretty significant steps to help folks that are in a financial bind as a result of coronavirus and COVID-19. First and foremost, it's important to know that the Pennsylvania Utility Commission has suspended all utility shutoffs during this crisis. So if folks who are impacted from losing their jobs or they're out of a paycheck for a couple of weeks while we weather this storm are unable to make their utility payments, utility companies, whether it's your gas, your electric, your water, your sewer, et cetera, cannot shut off your utilities during this crisis. This does not mean that you do not have to pay your bill. Anything that you choose to, or you are unable to pay, you will still be responsible for that eventually, but your utilities will not be shut off. It's a very important thing that we were able to accomplish. We are expanding, and we are in the process of developing better access using the internet for things like public assistance. People are going to be losing their health care if they lose their jobs. We know that we want to expedite and make sure that folks are able to apply for medical assistance so that if you need to go see a doctor for something, you're able to do so. That is being expanded online through the state's public assistance website, which is Compass. And you can contact any of your state legislators, state senators, or state representatives, and they have all of that information available to you. The last 2 points I want to mention very quickly is that the Department of Labor and Industry, which oversees all unemployment compensation issues with the Commonwealth of Pennsylvania, is, again, asking folks to apply online. If folks are laid off or are out of work for one reason or another due to coronavirus, odds are they will be eligible. They have to meet certain criteria, but by and large, many of those folks are going to be eligible for unemployment compensation, and we are asking folks to apply online as much as possible there. The last point that I have for the state's response is something that I have to give, once again, a lot of credit to our federal representatives and Congresswoman Wild. I know is a big help on this. The federal government is allowing the state to continue our food programs at our schools. I represent the city of Allentown. Over 90% of our children are free and reduced lunch. So if there are students that are hungry and need access to breakfast and or lunch, the schools are continuing their programs. Every school district in the 7th Congressional District is going to have to make a decision on how they're going to do it. Speaking for Allentown, which is the only district I represent, but I think is the model for most folks here, they're doing it as a grab-and-go system, where in one bag there are going to be two cold meals, so a breakfast and a lunch, so that students that are relying on schools to get their to get their meals will be able to do so and just swing by their normal schools to be able to pick up their lunches. So that is a very quick and comprehensive report. I will let folks know that the situation is ever changing as we develop more and more best practices for what's going on. We'll continue to release that information. Thank you, Congresswoman.
Thank you, Representative Schweier. I really appreciate that update from the state level. I'm sure people are going to have questions for you about other state questions. But in the meantime, I would like to turn it over to Dr. Peter Ender, Infectious Disease Specialist at St. Luke's University Health Network. And Dr. Ender, I'm going to ask you if you could, in your opening remarks, address the issue of social distancing, what it means, why it's important, and what kind of practices people should be following while they are at home with their families, teleworking or otherwise.
Well, first of all, I just want to thank both of you for the kind invite for this, because I think it is really critical to educate the public. And these can be scary times. It's not something we've seen, certainly during my lifetime. This is a pandemic that's gotten a lot of people's attention, and so I think we do need to take it very seriously. It's not a time to panic, because we have a lot of good people, a lot of really smart people trying to figure this out and implementing strategies to contain this COVID illness. And one of the challenges we have is while education is important, we are certainly at a phase where there's a lot we don't know, and what we do know is changing quickly. So we have learned a ton about coronavirus, this type of coronavirus causing this COVID illness. However, with much needing to know in the future, it can be challenging. But it may seem like this COVID process has been around for an eternity, but when you think about it, I mean, we only started learning about this in late December into early January, so it's been a very brief period of time to learn a whole lot scientifically. So I think in this time of not knowing, I think we should try to focus on what we do know. And at this point, if we focus on what we do know, sometimes that can give us a sense of where we need to go. First of all, I think everybody's aware that this is a very contagious virus. A lot to learn yet about exactly when it spreads and how it spreads, but a lot of very bright people think it's very similar to the influenza virus and how it spreads, but there can be some variation on that. Second of all, this is disproportionately affecting older individuals and those with chronic medical conditions. They tend to get more ill and be more likely to succumb to this illness. So these are the people that we really need to focus on protecting. Even if you're not in one of those groups, if you get infected, you can spread this infection to those groups, and they could have severe complications. Third, it doesn't appear to cause significant illness in the very young. There's been a paucity of only a small amount of kids that have been reported to become ill, but that doesn't mean they can't spread the infection. So they can be important propagators of the illness. So we still need to address all age groups when we're addressing COVID. And finally, I think everybody's aware that at this point, at least, we've been fortunate in the Lehigh Valley that we have only had very few cases. However, the surrounding area just around us, including pockets in Montgomery County, northern New Jersey, and into the New York area, New York City, and Westchester County, they have a much bigger problem. And so, even though we haven't seen some in the Lehigh Valley, I expect us to see a lot more in this district. And as far as social distancing, I think that's an important concept. We do know that social distancing can be effective as far as abating epidemics. And what is social distancing? It's basically spacing out people so that they're less likely to spread an infection one to another. And some of that is just distance-wise. The influenza virus is spread probably in a similar fashion in which it's You generally have to be within 6 feet of individuals to spread the virus, although, certainly you can sometimes pick it off surfaces and whatnot. That's a less common mode of transmission. But other types of social distancing, avoiding large groups, and that's why some of the recommendations from the CDC came out recently with, avoiding all groups greater than 50 as a strong recommendation. And we've seen, a lot of these athletic teams and programs in the NCAA. There's a reason. There's a reason that they canceled a lot of these events. It's to keep people separated in space so that there's not the likelihood of spreading between individuals. And so that's the basic concept of social distancing, separation in space, but also hygiene, good hygiene. Hand washing is critical as far as spreading infections, not just viral respiratory infections, but others. Washing and keeping clean, high-touch surfaces can have a big impact. So these are the types of things you've heard. I know people have heard over and over again on the news and other entities, in social media, but I think they deserve repeating. So I've already taken up too much time, and I'd love to hear some questions. So I'm gonna turn it back over.
Right. Let's do that. Ivan, if you could start us with the questions from the audience. Thank you.
Absolutely, folks. Before we take our first question, just want to, those of you who have joined us in the last few minutes, thank you for joining us. We have a telephone town hall tonight hosted by Representative Susan Wild. We also have Dr. Peter Ender, who's an infectious disease specialist at St. Luke's. And we have State Representative Peter Schweier. That's who you've been listening to. We will take our first question. This comes from Susan. Susan, go ahead with your question, please.
Yes, I have some health issues, so I've been very careful about staying home. My husband still works. We're both in our mid-60s. As of today, the governor announced that all non-essential businesses should close. Well, when he came home from work, we got the announcement after that, and he called in to work to find out, and they said, oh, no, we are going to continue to operate. We looked up the list of what non-essential is, and it's under that list. How do you judge when you say to your employer, I'm not supposed to be here, and it's not?
Congresswoman Wild, the response to that, please.
Thank you, Ivan. Part of that question got deleted, and I wasn't able to hear it, but I think I got the gist of the question, which was how do we determine whether something's a non-essential or essential business, non-essential businesses being the ones that are supposed to be closed pursuant to the governor's edict. Representative Schweier, can you field that question?
To the best of my ability, I will. And Susan, I believe it was the caller, and thank you for your question. The governor has said that he's not at this point in time suggesting to send out the National Guard. That was actually a question that was posed to him today. He did say that businesses that do not adhere to the order can face enforcement action. What those are, he did not specify. I don't want to speculate too far, but I can imagine there are some things that we can do to do that. I think it's going to take a lot of these businesses a day or two or three to be able to adjust to it. The overall goal and hope is that we don't have to do any kind of meaningful or widespread enforcement of this order, that businesses are going to be able to self-enforce. But at this point in time, the governor did not outline any sort of enforcement action, and we're all still waiting for a little bit of guidance from him on that. In the meantime, and I'm not going to ask you, it would be inappropriate to ask you on this call where your husband works. However, it's not the first time we've gotten that question today, and we're still trying to sort it out. The order from the governor is still pretty new, and we're waiting to get a little bit of guidance from him.
And if you submit your email address, we can also get back to you after this call on a more personal level.
Thank you, Congresswoman.
So, folks, please press 7 on your keypad, including Susan that we just spoke to. Please press 7 on your keypad to submit your email address to Representative Wild's office. That way you can be kept up to date on the latest coronavirus updates and other things that are going on in her office. We have operators standing by there. It'll just take you 15 to 20 seconds to submit your email address, so please do that. Up next, we have another Susan. This Susan is from Allentown. Susan, go ahead with your question, please.
I'd like to know if virologists or researchers have identified approximately how long an airborne virus can remain active in the air.
Well, that sounds like a question for Dr. Ender.
Yes, great question. We are hopeful, actually, that this is not an airborne virus. Similar to influenza, it's a droplet virus in which it falls to the ground within 6 feet, and so it would not remain suspended in the air for long periods of time. Now, if in the healthcare setting, if there are certain procedures that generate an aerosol, that the virus can remain suspended, and the way we're handling this in the healthcare setting is certainly that it could have some airborne component, but to this point, it seems to be similar to influenza. Now, when you talk about airborne viruses, those can remain, or airborne infections, those would be things like measles and tuberculosis. They can remain suspended in the air for quite some time, and hence the need for different types of containments and respirators that you would need to use to protect yourself from this type of transmission of infection. So yes, there's a lot of research going on right now that to look at that very question about how this virus is transmitted. While most people are handling it in the healthcare setting as if it could be airborne, a lot of the preliminary information suggests it's more like influenza in that it's droplet and that it does not remain suspended. I hope that answers your question.
Even in the medical context, this is still an evolving issue.
Absolutely. Dynamic information, and it really evolves daily, not only in research and publications, but that is reflected in the guidelines you see being adjusted by the CDC.
Great. Ivan, you want to take the next question?
Yes, please. This is Michelle. Michelle, go ahead with your question, please.
Hi, Representative Wild. This is Michelle. I'm calling to get some clarification really on the legislation that was passed to provide resources to workers who are out of work because of coronavirus. And there's now a lot circulating around that's saying companies over 500 or under 50 are exempt from that legislation, which is just about everybody I know. So do we have some direction for workers on what they should be doing?
Thank you for asking that question, Michelle. So I want to just address the provisions of the Families First Coronavirus Response Act, which was just passed by the House of Representatives early Saturday morning. It was around 1 a.m. It has yet to go to the Senate to be passed, but I'm going to address only the parts having to do with paid leave, even though there are a whole lot of provisions in that act that I'm happy to address. And one thing, even though it doesn't address your question, Michelle, I do want to mention that everyone, absolutely everyone, is entitled to a free test for coronavirus should it be deemed necessary by your health care provider. So that doesn't mean that every single person in the United States gets a free coronavirus test. However, if you have a health care provider who deems it necessary, that test will be provided free of charge, regardless of whether you're Medicare, Medicaid, uninsured, have a private insurance plan, or whatever. But getting to the question that Michelle asked about paid leave, this is the question that we are getting most from people, and of course is the subject of the greatest concern, because we don't really know what an economy looks like where people are directed to stay home if they are part of a non-essential business. So the paid emergency leave provides 2 weeks of paid sick leave and up to 3 months of paid family and medical leave. So let me address who the eligible individuals for that would be. It would include people who are actually diagnosed with the coronavirus, meaning you've had a test and you've been diagnosed as positive, you would be eligible under this act for 2 weeks paid leave. People who are under quarantine, including those people who are under self-imposed quarantine. So, for instance, you know somebody who has been diagnosed as a positive coronavirus, having a positive coronavirus test, and you elect to self-impose a quarantine, you would be eligible for the 2 weeks. Also, people who provide care to an individual who has been diagnosed and caring for an individual who is affected by a school or daycare closing triggered by the disease. So all of the parents on the line who have to take off work because their child's school has been closed would be eligible for this 2 weeks of paid leave. So the question that you asked has to do more, I think, with people who may elect or people who may not be covered by this but have to stay home. Is that right, Michelle?
I think we've lost Michelle.
Okay. I think Michelle is muted. I think it's important to know that individuals would not be eligible for paid emergency leave days if they received any type of compensation. So if you were eligible for unemployment during that time, or you received paid leave from your employer, including those employers who are more than 500 employees, you would not be eligible for the paid sick leave under this policy. It would only apply to those under 500 employees or the categories that I mentioned before.
Okay, up next we have Christy. Christy, go ahead with your question, please. Are you there, Christy? I'll read you Christy's question. This is Christy from Bethlehem, and her question was about closing small non-essential businesses. Is there a timeline on when these businesses are going to be able to reopen?
Well, I'm going to start the answer to that, and my fellow participants can chime in if they wish. I don't think there's a timeline on when businesses might be able to reopen because we don't know yet. This is a constantly evolving situation. We don't yet know the full scope of the virus, the disease, or how long it will last. But Dr. Ender, do you have any thoughts on that question?
No, I totally agree because it's such a dynamic process. And the hope is through these containment and mitigation practices, as they're called, we can not have a steep epidemic curve where cases are increasing and increasing. And if we can flatten it out and control it, and right now it's a lot of unknowns. Things were different in China as they were in South Korea, both of which have had some success flattening this out with kind of a similar approaches as far as containment and mitigation. Obviously, we cannot be as aggressive as China has been, but certainly some of the processes that have been laid out in other countries such as Singapore, but they took a while. They took on the order of weeks to months, and it's hard to predict. Our country is very different than those countries, so it's going to be hard to predict exactly when that may happen.
All right, we will take our next caller. Margie, go ahead with your question, please.
Hi, I own a small business with 7 employees. It's a hair salon. We run on a pretty thin margin. My employees are really concerned about the lag time. I had them fill out the paperwork today for the unemployment that the state is offering, the COVID unemployment program that the state of Pennsylvania is offering. But what would the lag time be for payment? These are folks that cannot afford to be without pay for more than 2 weeks.
So before I pass that question over to Representative Schweier, I just want to mention that before we ever did the Families First Coronavirus Response Act, the House of Representatives passed an $8.3 billion emergency coronavirus package the week prior. So we're now 2 weeks out. And that bill actually includes money that will go directly to the states to deal with some of the economic impact of this. The idea being that we need states to be able to be responsive very, very quickly. So that money is in the pipeline to the states. Much of it has already been received. And with that, I'm going to turn it over to Representative Schweier if he has any specific direction.
Thank you, Congresswoman, and ma'am, thank you. I'm sorry I didn't jot your first name down, but I want to thank you for taking that proactive step with your employees. Any other small businesses small business owners that you know who are that you're in contact with, if you can share that what you've done with them, it's very important that folks try to be as proactive as possible. Typically, it could take anywhere from 2 to 4 weeks until the first check is cut, and I know that's not a perfect scenario. That's assuming that there aren't any kind of problems with it. Now, in your particular case, you're not challenging an unemployment compensation claim, so it should go a little bit quicker. We have been now we have historically faced delays when there are big spikes in unemployment requests. So I anticipate it could take a little bit longer this time, but as always, the sooner people get their applications in, the sooner they will be processed, and the sooner the turnaround their benefits can be paid out. I will say that because again that you've done you're not challenging it, it should be quicker than most turnaround times. Than those cases where employers are contesting an unemployment compensation. It is also important to note 2 factors. Number one, even until they actually get their determination of eligibility, your employees still have to check in every week or every 2 weeks with unemployment compensation. That way their case remains open. And then also they will get all of their back benefits. So that first check is usually significantly larger than their typical weekly or biweekly ones because they get their back benefits too. So thank you for helping them out. Thank you for doing the right thing. And we have all been pushing Department of Labor and Industry to make sure that they're fully staffed and staffed up to process the claims as quickly as possible.
And the last thing I'll add before we go to the next question is presumably people are just on day one of their unemployment, so that by the time the state and the federal government has the chance to implement all of this, by the time people's paychecks are due, we hope to have everything up and running smoothly. We can go to the next question now.
Thank you. Up next, we have Jackie from Central Valley. Jackie, go ahead with your question, please.
Hi, thank you, and thank you to all of you for putting this together. This is wonderful. I want to compliment Pennsylvania. I think has been having a great response to all of this. In terms of health stuff, I can see from the health.pa.gov site, the Pennsylvania Department of Health site, which is where I've been really checking in a couple times a day, that we have in Northampton and Lehigh counties only one recorded case in each county. And as Dr. Ender mentioned, that we can expect more. Is the one case in each county due to the fact that there's been no testing? And what's your best guess, if you have one, without being alarmist, but we have to look at the curves, right? When we can expect spikes, kind of a spike, looking at all the data from the other countries and states like Washington.
Dr. Ender, you want to field that?
Sure. Great question. Again, a lot of unknowns, unpredictable based upon the dynamics of the population, but I think at least partially the fact that we have only seen one case in each county is a reflection of testing. However, the testing has ramped up significantly in the last week or so. And so I do anticipate more cases to be identified in Lehigh and Northampton County. Some of it may be due to certain dynamics about certain areas and connections. Sometimes it's really difficult to really understand how an epidemic moves until you figure out what those bridges of connections are between different communities. So it tends to be you look back at it and say, this is how it happened and why this area got more cases initially. So fortunately, so far, we haven't seen a lot of cases, and I can tell you just from personal experience in the hospital, we have not seen a dramatic increase in unexplained flu-like illnesses. However, I think part of it is going to be a reflection of testing, and we will start seeing an increased number of cases reported moving forward.
Next
All right,
question.
let's go to our next question. Fred, go ahead with your question, please. Fred, are you there?
Yes, I am. Oh, I have a two-folded question for you. The first one is how are we going to control the groups larger than 10 in a grocery store as we're going shopping? And the other is the restocking of the groceries. Initially we were told that, hey, we should prepare for 2 weeks to 10 days. Now it looks like it's going to stretch even further. And the stores just don't look like they're able to keep up with the restocking. So I'm concerned about both. If you could address that, that would be helpful. Thank you.
So I'm going to start with the answer to that. This is Representative Wild. By saying that this is, as I said at the beginning, a constantly evolving situation. If you recall, in the beginning, certain governors were telling people to avoid crowds of more than 250 people, and then it went down to 50 people, and now it's down to 10 people, according to the administration. So this is obviously something that is really very much in flux. The best thing that I can say, and I would invite my co-participants to add anything they want to this, is that to the extent that you are able, stay home. Stay with your own family members. Don't engage in play dates with other children. If you've got children at home, I know that the churches have gone to online services. And I think that as much as we can, it is our obligation, every one of us, to make sure that we're not engaging in conduct that would put other people at risk or ourselves at risk. So with that said, if anybody has anything to add to that, I'd be happy to hear from them. My concern is that we don't really have any way of knowing what the grocery store supply chain looks like. I've spoken to the grocery store managers in the area. They all seem to be confident that they would continue to have ongoing continuous supplies. I would encourage people not to hoard and to only buy as much as you believe your family needs over the course of the next week or two. So with that said, Dr. Andrew, do you have anything to add?
Just less is better. I mean, it's, if you can have less interaction in the community, it's better. So I can't give you specific numbers. Certainly, if you're a more high-risk individual in a high-risk age group or with chronic medical conditions, you should be particularly thoughtful about that. But even if you're younger, because you could spread it to some of your parents or grandparents who are in those age groups, or somebody who you know and care about who has chronic medical conditions. So the less is better, less exposure to other individuals and groups. And I agree with your comments completely that it's best, unless you don't have to, it's probably best at this point to just lay low, and easier said than done sometimes. It can be this is something we've never seen before. So
up next is Jeff from Lone Rapids. Jeff, go ahead with your question, please.
Hi, this is Jeff, and I was wondering, as a first responder, is there any plans to supply the first responders with the 95 masks and stuff? I mean, we all have X amount, but we're possible we're going to run out.
So, Jeff, Susan here, and I will tell you that one of our greatest concerns in Congress, I would guess at the state level as well, but one of our very first concerns is what kind of supplies the first responders have. We are aware that there are concerns about not only masks, but also hazmat suits and that kind of thing. And it's all, we are working very hard to make sure that first responders have, as well as, I should say, nurses and doctors and all the other healthcare providers have the kind of equipment that they need. That is a top of the list priority for us.
Okay. Like I said, I just got a thing from FEMA that it's possibly reimbursed through them, but if you can't get it, you can't really reimburse it. You know what I'm saying?
Exactly. Now we have to make
All
sure
right.
our supply side is dealt with.
All right. We are having just one little technical glitch. So, Congresswoman, while we work that out, I wonder if you or anyone on the team has any comments as we're here halfway or a little over halfway through our call.
I actually do, because I was going to save this for the end, but while we have some time here, I would like to invite people to review the resources that we know are available. Please make sure you go to wild.house.gov/coronavirus. We have a whole lot of resources listed there. We've got resources on how to get tested, a testing fact sheet, people at risk for serious illnesses, what community and faith-based organizations are doing, schools and child care program checklists, cruise ship travel, and all kinds of and this is literally updated not daily, but several times per day. So make sure that you're checking it tomorrow. We're going to be adding resources regarding school closures, essential versus non-essential businesses that are determined at the local level, price gouging if you're experiencing a situation where you're being charged a ridiculous amount of money for toilet paper or hand sanitizers or whatever. Please report the price gouging. There is a website to do that, and some mental health support. So with that, I'm going to turn it back to Ivan. I can keep
Thank
going,
you.
Ivan? Okay.
We're ready to go. Thank you very much. Alice, you're next. Go ahead with your question, please, Alice.
Yes, good evening. Thank you for having this town hall. I really don't have any medical questions for you. However, it appears that this quarantine is going to take us through the tax season. So are there any plans to push back the submission of our taxes for this year?
Alice, I'm glad you asked that question because a lot of people have that concern. I will tell you that what I am hearing, it hasn't been confirmed yet, but that tax deadlines are likely to change. As right now, we of course have an April 15th filing deadline for individuals, as well as payments for 2019. I am told that those deadlines are likely to change. I also would remind everybody in the interim that you have the ability to get an automatic extension of time for filing your tax returns, which requires the filing of a form with the IRS, although it does require the payment of your estimated tax liability. But you might want to avail yourself of that if you have serious concerns about meeting that deadline. But I think we're going to be getting notice very quickly about that, and we will post that on our website as soon as it is available. And thank you so much for that question, because that, of course, is very much top of mind for a lot of people right now.
Thank you. Marianne is up next. Go ahead with your question, Marianne.
Hi. Thank you for having me. My son is a mail carrier, and I'd like to know his risk for contagion.
Dr. Enzer, do you want to comment on a postal worker's risk for contagion?
Sure. The fortunate thing is mail carriers, spend a fair amount of time outside. So, I think the primary risk for a mail carrier may be as far as, touching surfaces, opening doors, that type of thing, opening a mailbox. But to be honest with you, the type of virus that coronaviruses are, they're RNA viruses, and they don't live that well in the environment, particularly if there's not secretions around those viruses. Now, when you look at studies about how long these things have lived in the environment, similar ones such as SARS that have been studied, they could live anywhere, depending upon the conditions, between a few hours to several days. But in an environment where there's you're outside, there's sunlight, there's air moving around, the environment, the likelihood of catching someone in that this type of virus in that setting makes it much less likely. It's just good to use hand hygiene frequently as you're touching surfaces, and don't touch your face. Because basically it could be transmitted, particularly if these viruses get up towards your nose or mouth. So, but with good hygienic practices, he should be relatively low risk because it's not like he's going into the houses of individuals.
And just to follow up on that question and answer, so far we have not been advised of any interruption in U.S. Postal Service services for anybody who might wonder. So as of right now, it's anticipated the Postal Services will continue as scheduled.
Thank you. Up next, Josephine from Bethlehem. Go ahead with your question, please.
Hi. The question that I have, I'm 43. We have 3 kids in the district. They're home now. My husband works in Allentown, and I was diagnosed 4 years ago with MS. So this whole, not being around people, now it's down to 10. I'm curious about, what to do with having, 3 kids in the house and things like that. And also reading what happened. I guess someone was diagnosed and they live in Bethlehem, but they work at the Lehigh Valley Hospital. I just wanted to know how true that was, just trying to stay on top of things. If you guys could.
I'm going to turn it over to Dr. Ender, but my understanding is that there was an individual diagnosed as positive who is an employee at Lehigh Valley Hospital. And the only thing I will say before I turn it over to Dr. Ender is under your circumstances, given that you have MS, you obviously need medical advice as to whether your husband should refrain from going out to work and so forth, or whether he should remain home as well and would potentially be eligible for the paid sick leave because he would be in a situation of caring for people affected by the coronavirus school closings. But Dr. Ender, you have anything to add to that?
Well, the only thing I would say about the case that was alluded to is just basically what I've seen in the news. I mean, I don't have any personal information on that case, and I think you've already mentioned that. And again, it goes down to the same types of things talked about: social distancing, separation in space, and in the home environment. That's easier said than done sometimes, but cleaning high-touch areas frequently, hand washing, coughing into kind of the elbow area, and just using good distancing and hygiene practices can go a very long way. So you just have to be more cognizant that you do have a health condition that may put you at increased risk of certain types of infections and illnesses, and you just have to be a little bit more meticulous about those things. But it's a challenging situation with a contagious virus.
Dr. Ender, part of my response to the caller had to do with the fact that she has MS. Her husband goes out to his normal workplace every day and presumably is at greater risk of carrying home the coronavirus, and she would need to talk to her own health care provider. But that raises the situation of whether he might need to stop going to work so as not to compromise her health. Am I correct about that?
Well, it depends on the nature of the work, number one, and two, it also depends upon what type of treatments an individual is receiving for MS, because not all treatments are the same. It's mostly the treatments for MS that would put her at higher risk of a complication. So, it's a very individualized decision that has to be done, and without knowing all the details, I'd hate to make a blanket statement about whether or not he should be going to work or not.
All right, up next we have Larry. Larry, go ahead with your question, please.
Yeah, this is Larry from Northampton area. Why are these 2 weeks, these specifically picked 14 days, going to help us stop this? Why not the week after or next month? If today the president said this can go into August, how crucial are these 14 days?
Dr. Ender?
Well, I think, and again, I wasn't there when decisions were made about durations, but part of it is that you set a time frame, and as you get toward the end of that time frame, you reassess. So those 2 weeks, maybe something has drastically changed in 2 weeks that'll make you deviate for some of the practices that you've implemented, some of the social distancing practices. So I don't think those were set in stone as far as, this is going to definitively be the end of this. But I think sometimes if you set things too far out, you may have to realize, a month or a month and a half into it, say you may realize that, we probably should have chosen X, Y, or Z. So I think by setting a time to give you more time to analyze the situation and see how an epidemic curve is developing and what communities are being affected most, you can kind of regroup and kind of make decisions moving forward.
Am I correct, Dr. Ender, that the incubation period is potentially as long as 2 weeks, and maybe that had something to do with that 2-week period?
That's how they initially said it, but that's, when you have kind of a wide, more widespread epidemics in certain areas, you're going to have people exposed over time during that period. So the 2 weeks, but yes, absolutely. It's felt based upon all the data we have out of China, in particular, in other outbreak areas, that it appears that 2 weeks is the outside. Most individuals get sick within, on average, around 5 days, and then all of them that have been. There's been one outlier that was beyond 2 weeks, but that wasn't well vetted scientifically, and so we'll have to see how that plays out. But 2 weeks is felt to be the outside end of the time from exposure to illness.
Thank you. Up next is Sharon. Go ahead with your question, please, Sharon.
Hi. My question is two parts. Does a fever always accompany this infection? Because if you have a sore throat and no fever, should you assume it's just a normal cold? And can a person be reinfected after they've gone through this process and be determined clear?
That's definitely a Dr. Ender question.
So I never, we learn in medical school, nothing is ever, always or never. So is a fever a common symptom of COVID illness? Absolutely. So when you look at the studies that have been done, 80 to 90% of people presented with fever. So not everybody has a fever initially. The huge majority of people will eventually develop a fever. So the illness tends to start off as a more mild illness with a dry cough, and then subsequently you may start spiking fever, and then eventually if things progress, you can get some shortness of breath and become much more ill. But I never say, there are probably a lot of people out there that get viral respiratory infections and don't have fever. And I think until we do a lot of testing and have a better feel for who all gets the infection, we're not going to know exactly how many people may have much milder illness that may not include a fever. As far as reinfection, so if you think about what the flu does, you can get reinfected with the flu like the following year. So if this takes a pattern of what we think about influenza and perhaps other forms of coronavirus, you have some temporary reprieve of immunity. It's unclear whether that immunity will last long-term or it'll be more short-term, as we see with flu that can make some small genetic variations, and then you're susceptible once again the following year, short of vaccine and other interventions. So I don't want to say you can't be reinfected. I think it would be very unlikely to get reinfected in the short term with the same strain after you've already cleared the illness.
Thank you. Up next, we have Anne. Go ahead with your question, please, Anne.
Hi. Thanks for doing this. I appreciate it. I'm wondering if you call one of the hotlines now, the LDHN or the Sacred Heart hotline, what the criteria for getting tested would be.
So
when you do the
okay, go ahead. Finish.
When you do the video call and they talk to you, is there any kind of a general idea of what would enable you to get tested?
Well, from a layperson's point of view, and then I'll let Dr. Ender chime in,
I will tell you that I believe that every situation is different, that you're going to be asked about your points of contact, where you've been, where you've traveled, what your specific symptoms are, whether you're running a fever, and all kinds of things, so that just like any two patients who come into a doctor's office, every single case is going to be evaluated on its own situation and facts. But Dr. Under, anything to add to that?
No, absolutely. So they're going to make a clinical assessment based upon what kind of symptoms you have. So if you have fever and a cough and perhaps shortness of breath, a number of different viral respiratory infections could cause that. The one that usually comes in mind, statistically in year in and year out is influenza. So, and then there's an assessment as to what your travel history is. Have you been in communities where there has been more kind of community transmission rather than just travelers coming into an area and bringing an infection? So there's that type of an assessment. And so that decision is then made by the clinician who's evaluating you, and then they make a determination whether they'll refer you for testing. And sometimes what we'll do is we'll say, well, let's do some of the more common things first in our community. Let's test for the flu, and then if we find an explanation, you get treated for the flu. Or, we may look at other respiratory infections that are more common in the community. So you may not get to COVID testing until we've kind of ruled out influenza infection and some of the other more common viral respiratory infections. And then at that point they say, there may be a decision, okay, compatible clinical illness, there may have been some exposure history, I think it's indicated to do the test now. I hope that answers your question.
Thank you very much. Unfortunately, we're at the end of our allotted time tonight. Before I turn it over to Congresswoman Wild to wrap up, just want to remind folks that if you do have a question that you weren't able to get answered tonight, and if you were wanted to submit your email address and didn't get a chance, then please leave a voicemail at the end of this message. So right as the call ends, you will have an opportunity to leave a voicemail with your question or with an email, and we'd appreciate it. Congresswoman, we'll turn it over to you to bring us to the finish line.
Thank you so much for wrapping this up. I know that there is a lot of interest on this. The questions were great. I'm sure there are many more questions that people want to ask. I would invite you all to visit our website, to call my office. Our numbers are on our website. Same thing for Representative Peter Schweier. He's got a website that you can all access. And most importantly, I would advise everybody to bookmark and follow cdc.gov, which is the Centers for Disease Control, and as well as pahealth.gov, pa-health.gov, which is the Pennsylvania Health Department. And just to remind everybody, there are two hotlines right here in our area, St. Luke's University Health Network. You can access by going to 1-866-785-8537 and use option 7. And for Lehigh Valley Health Network, it's 888-402-5846. And both of these will provide you with additional information as you may need it. And I really strongly encourage everybody to avail themselves of these resources as we move through these difficult times. We will be continuing to have a series of phone calls with our working group of community leaders. We will push information out the minute we receive it so that people in the community know what is going on. I know this is a very distressing and confusing time for all of us, and it's our goal and our ambition to make sure that your questions are answered as quickly as possible and as honestly as possible. So with that, we're going to conclude the conclude the telephone town hall, but I would again encourage you to visit health.pa.gov for supplemental information. And the State Department of Education also has its own website, which you can easily Google and get information about any updates regarding school closings or getting the lunches and meals that are available to students.
So with that, we are going to conclude this telephone town hall. Thank you all for participating. I really appreciate it. And special thanks to Dr. Ender from St. Luke's University Health Network and to State Representative Peter Schweier for their participation in this. So valuable.